Aprn video project, we'd like to show you an example of a telehealth call where a patient and provider share their honest but typically unspoken thoughts about the Well Woman exam. We hope that through this video we can highlight some of the real patient-provider issues that we can tackle as future providers. Now I'll wait for my nurse practitioner to enter the room so that she can prepare me for my Well Woman exam and pelvic exam next week.
Hi, my name's Alexa. I'm going to be your nurse practitioner seeing you today. What name do you like to go by?
Okay, nice to meet you. I go by Kylie.
Welcome to our practice, Kylie. So for the first part of this annual visit, when I'm seeing you through telehealth, I will first just gather history from you, so it won't be too long, and then I will go on to explain the pelvic exam I'll perform next week, just to make it as comfortable as possible. And I'll try to remember not to tell you to spread your legs.
Okay, awesome, because the last NP I saw said, "You're gonna feel me coming," and it was super, super weird.
Yeah, it's really easy for something really awkward to slip out. So anything in particular that brings you in today?
Not really. It's been a few years since I came in, so I just figured that I should. Well, I may have had a few one-night stands after half-price wine night, and I'm not totally sure if I have an STI or an ingrown hair. But I'm hoping that I can just ignore it.
Well, great. We love it when patients don't come in consistently. Are there any symptoms at all you've experienced? Irregular periods, painful menstrual cramps, discharge, pain after intercourse?
Yeah, those happen sometimes.
Oh, really? Did you forget to mention them at the beginning of the visit?
I guess so. When I've come in the past, nobody really asks me any questions. We kind of just get down to the exam part, and I'm not trying to make that any longer than it needs to be. I want to get out.
Okay. Sometimes as providers, we get really tired and just decide not to take a full patient history. I guess I'll take one now. So just tell me about your symptoms.
Well, I've had some discharge and some pain during sex, but sometimes it's not that noticeable, and I'm sure it's fine.
All right, like you said, it probably is fine if it's not consistent. So I'll see you in person for the pelvic exam next week.
Now I'm back in patient and explain mode. So some of the things we wanted to highlight in our video is that patients don't often come in for an annual exam, and depending on the type of practice and whatnot, especially for a pelvic exam, it's not the most fun. You're laying there with your knees spread to the side, just hoping your doctor doesn't say anything awkward. We need more providers who ask the right questions and dive deep into our concerns. We need providers who are not rushed and go beyond a couple quick exchanges and into a thorough history and examination of our concerns. Not those that dismiss our complaints as probably fine. There could be so many contributing factors to our health, but sometimes we need someone who will help us uncover the truth.
And from the nurse practitioner end, we understand that exams, especially the pelvic exam, can be extremely uncomfortable, especially to come in for them regularly. However, we want women's health NPs who create an open environment and empower patients to be involved in their healthcare journey. So much so that we want them to want to come back for their annual visit. And we want to maintain professionalism while relating to our patients in order to avoid those tongue-tied moments of accidentally blurting out possibly weird sentences while taking a thorough assessment. And with healthcare just being so busy, these days we understand that it's easy to meet your patient and immediately just start in on the physical exam and get stuck on symptoms and management, but we want to break that mold of being rushed through gathering a thorough history because that is so important. And we aim to ask the proper questions so that our patient doesn't forget about some real symptoms they might be experiencing, and later to remember them maybe halfway through the visit. So
Thanks so much for watching.
thank you.